Good afternoon, everyone. I believe that we're live and that you can hear us all. Welcome to the Monash Health Graduate Program Virtual Expo for 2021 programs. My name's Stacey Rogers. I'm one of the Graduate Program Managers here, and as you can see, we're live with our Graduate Program team, and we'll go around and do some introductions a little bit later on. But to welcome us to the Expo, I would like to hand over to Jo Begbie, who is our Director of Nursing for Nursing and Midwifery Education and Strategy. I'll hand over to you now, Jo. Thank you.
Stacey, and good afternoon, everyone, and welcome to this WebEx event. It's fantastic to see you all here. It's very, very exciting. I'd firstly like to respectfully acknowledge the traditional owners of the lands on which we meet and pay my respects to elders, both past, present and emerging. And I would like to pay my respects also to graduate nurses and midwives at Monash Health, past, present and emerging. And you, of course, are the emerging. It's every year is very, very exciting to go through our recruitment process and this marketing phase. And we always love the face-to-face events that we hold when you all come and talk to us and ask your questions. Of course, this year with COVID-19, we can't do that. We have to be virtual. But this is actually working really well, and you'll get just the same amount of information that you all that you would have had in the past, and you'll be able to ask your questions on Slido. We're going to put FAQs out that cover off all the questions where, every year people have the same questions, and then there's always some curly ones, some curly new questions as well. So we've got it all covered. I'm hoping to recruit lots and lots of you to Monash Health. We're thinking that we'll be recruiting around 600 total. That's nurses, midwives, mental health. We haven't finalised our numbers, but they'll be finalised by September. And we, of course, are huge at Monash Health. We've got lots of sites. We've expanded this year into some new wards. The Casey Tower has opened and given us some new wards and a new ICU, all brand spanking new, which is very nice. And we've got graduates everywhere. There's virtually nowhere off limits. So our graduate program is expansive and, a huge variety of places that you can go. Of course, you can only go to 2 to start with, but I like to talk about the Monash Health for Life program, because for your professional life, you can come here and there are so many different avenues that you can follow, and you can change paths, and so many different areas and sites, community, inpatient. It's a fantastic place to work. Most of us have been here for a very long time. And that's what we'd like to see for lots of you as well. So our graduate program is very, very important to Monash Health. It's our major recruitment strategy for the organisation. That's why we take so many graduates. We know it's a lot, and consequently we put in a large amount of support so that you make that transition to your professional life from students as seamlessly as possible. And I'm just really looking forward to recruiting hundreds and hundreds of grads, and then seeing you all at orientation and induction, and then seeing you out on the clinical wards and units. So I could crap on all afternoon, and that's not what you want. You want to see the graduate team. So handing back over to them, and I'll see you all soon, hopefully.
Thanks so much, Jo, for opening this event for us. So before we get started, we're just going to hand over to each member of the team, and they're going to introduce themselves to you and tell you what their role is here at Monash.
Hi guys, welcome to our expo today. It's so exciting to have you all here. My name's Anne-Marie. I'm one of the graduate program managers, and I work within this team.
Hi everyone, welcome. My name's Melanie Bishop. I'm the clinical support nurse for the grad program. I hope you enjoy the presentation.
Good afternoon all. My name is Shelley Black. I'm the clinical nurse consultant. and look after the graduate program for mental health. So welcome.
And as I said earlier, my name's Stacey Rogers. I'm one of the other graduate program managers that works within this team. Tim, can we have the presentation up, please? So before we kick off, just a quick outline of what we're doing today. A lot of you would have got the reminder which had the outline attached, but just as a little refresher, we're going to start with a presentation about the program streams, the recruitment process and the interview process. So that'll take about 50 minutes. And then after that, we're going to hand over to Mel, who is going to facilitate our 2020 graduate panel. And then we're going to close out with our manager Q&A and our prize draw. So we have got Slido set up today where we're accepting questions, and Mel's going to take you through how we're going to use that. Can we have the next slide, please, Tim?
Thanks, Stace. So as Stacey just mentioned, we will be using Slido. So if you can go to slido.com or you can download the Slido app and enter the event code hashtag uppercase MHGP 2020, and there you can submit your questions to our graduate panel or to our graduate managers as well. So I will be facilitating the Q&A. We will also ask for you to participate in our polling. So on Slido there's two options. There's the Q&A option and then there's the polling option. We have our first polling question ready to go now. So if you'd like to just jump on Slido and answer our first question for us, we'll get the presentation started. And I will see you all shortly. Thank you.
Thanks, Mel. Okay, so we can see everyone coming up. If you haven't jumped on the Slido yet, please do so. We'll be using it throughout the expo. Great, a lot of nurses here today and, double degrees. And mental health.
It was 44 last week.
Fantastic.
Yeah.
Welcome, guys. It's great to see you all here.
Double degree.
Yeah, lots of double degree. Welcome to our double degrees. And our nurses. And we've got some BMids joining us today too. Hi, guys. Okay, so we might get started with the presentation so that we can stay on time. Can I have the next slide, please, Tim? So, as you guys will have known, this year has been an incredibly busy year for health services with the COVID-19 pandemic. And that is on top of a lot of activities that are already going on at Monash Health. So as many of you would have been aware, Casey Hospital has recently undergone an expansion, and they now have their shiny new tower block out there, and their new ICU has recently opened its doors as well, and we're very pleased to say that we have two of our grads rotating into the new Casey ICU in August, so that is very exciting that they get to work in that shiny, lovely new unit. We also have grads rotating into the new wards that are open up there, the medical surgical wards. Many of you will have, when you've been on site, seen the Monash Children's Hospital, which has recently celebrated its 3rd birthday, which I think is just such a surprise to all of us, because the 3 years seems to have gone very, very quickly. On top of that, many of you would have been driving past the Monash University at Clayton site and will have seen the work starting for the Victorian Heart Hospital, which will also be a Monash Health facility, which is very exciting. At the same time that all of the COVID preparations have been going on, the emergency department here at Clayton, of course, is also undergoing its upgrade. And as part of the COVID response, you can see in the bottom middle photo that amongst the building site, there was an area that was sectioned off, and semi-permanent resuscitation rooms were actually created as part of the COVID workforce planning and response to planning. So Monash Health treated the first COVID patient in Australia, and we're proud to continue to support the community response to COVID. Next slide, please, Tim.
So welcome again. So this slide is just a very brief overview of our streams that we have here with our graduate program. Obviously all this information is available on our booklet and on our website too here at Monash Health, but this is just a brief overview. So as you can see, we've got our nursing, mid and double degree streams. So within the nursing stream, we obviously have got the acute and complex care. So these two streams obviously start at the beginning of the year, the 8th of February 2021. We also have our mid-year intake, which commences on the 9th of August 2021 as well. With regards to mental health, they start at the beginning of the year, but you can see it's an earlier start on the 25th of Jan. Sherry will be discussing providing more information later on during the presentation with regards to the mental health stream. We also have our PMCV APS, which stands for Allocation Placement Service. And this refers to, obviously, we do have streams for our ineligible nursing applicants as well. And they are eligible to apply for their streams both at the beginning of the year, February, and also mid-year as well. Again, as I said before, this is quite a busy slide, but all this information is available on our website and on our booklet. Moving over to the BMID, again, same dates, in February, we have our guys starting as well. We also have an intake on the 9th of August, and again, we do open this stream to the PMC being eligible mid applicants as well. And these guys can apply for both the Feb and the August intake. The last slide is obviously in relation to our double degree applicants. So again, as you can see from the dates, it's the beginning of February 2021. We also have an intake in in August as well. And again, we have opened both these streams to our PMC being eligible applicants as well. And these intakes occur both in February and August as well. Can we have the next slide, Tim, please? So just, it's a bit of a mouthful here, PMCV APS, an eligible stream. So what that really relates to is obviously, it's an entry pathway that we provide for those applicants who are not eligible to participate in the PMCV allocation service. It is important to remember that obviously when it comes to the application and recruitment process, it's the same. When you go for your interview, filling in your paperwork, as far as it is all the same. However, one of the most important things that these guys have to remember is that offers are released post the PMCB offers are made. So again, this information, we provide quite detailed information in our booklet to answer any questions that applicants who fall within this category. And again, we're more than happy to take questions during our Q&A session.
Can I have the next slide, please, Tim? So one of the most common questions that we get asked here at Monash Health is, what are the differences between the streams? As Joe said, we have 600 graduates, nurses and midwives across our organisation, and we are one Monash Health. So we have one graduate program, and there are many different streams within that graduate program, depending on what time of the year the graduate starts, and of course what professional stream they're in and what specialties you're interested in. So in February, for applicants who are eligible to participate in PMCV APS, used to be called PMCV Computer Match, but is now being changed to Allocations and Placement Service, APS. You can choose to apply to the acute care stream, the complex care stream, or the August stream. So the three streams, the actual structure of the streams is exactly the same, and Anne-Marie is going to talk in depth about some of the support that we offer as part of our graduate program streams, but we really wanted to highlight the key difference first off, because this is the question that we get asked most commonly. So if you are in the acute care or complex care streams, our graduates are allocated at least one of their specialty preferences for at least one of their rotations. The other rotation would be what we call their non-preference rotation, and it might be in either their first or their second rotation, and in their non-preference rotation the graduate is placed in an area of our choosing and could be anywhere across the organisation, but they are guaranteed one of their 4 specialty preferences for at least one rotation. So those graduates in the acute care stream can pick from all of those areas listed, and those graduates in the complex care stream rank 4 areas out of cardiac, peri-op, emergency, intensive care, nephrology and hemodialysis, and residential and rehabilitation. Same with the acute care stream, the guys rank 4 preferences out of that list. We often get asked as well if we have a paediatric stream. No, at the moment we don't. Instead, paediatrics, because there is quite a lot of paediatrics here at Monash Health, is actually amalgamated into both the acute care and the complex care streams. So for example, in complex care, you can see that if I as a graduate listed peri-op as one of my preferences, I may go to either an adult or a paediatric perioperative area as part of that preference rotation. Those graduates in the August stream get the opportunity to nominate 4 specialty preference areas out of both the complex and the acute clinical specialties available. However, the main difference is that for graduates in August stream, we're unable to guarantee that they will rotate to one of their preference areas. We do our best to accommodate where possible, but unfortunately we cannot guarantee that for the August stream. For our PMCV APS ineligible nursing, the rules are the same as the course rules that govern August. So you're able to nominate 4 of your preference areas out of both the acute and complex care stream areas. And while we do our best to accommodate where possible for at least one rotation, we don't guarantee that you will go to one of your preference areas. And that's for both the February and the August intakes for PMCV APS ineligible graduates. Other than that, the the structure of the 4 streams is exactly the same. And Anne-Marie is going to go into a little bit more detail about what makes up the structure of each of the 4 streams. So before we move on, we might do another question. We'd love to hear from you what clinical areas you are most interested in. So please click over to the poll tab in your Slido. And, oh, fantastic. You guys are so on top of it.
Mental health again.
Yeah, go mental health.
Surprise, surprise, paediatrics, ED, cardiac, ICU.
Look at ED.
There's our midwifery.
Yay.
NICU's coming up, yeah.
Palliative care, that's good.
And newborn.
Surgical.
And there's intensive care. And cardiac's getting some love. And spinal, nice.
Very up.
Plastics, yeah.
Midwifery's getting bigger.
Yeah, there's our midwives coming in.
Neurology, surge, acute surge, nursing, it's always good.
Perioperative's popular tonight, actually.
That's 170.
Theatre. Nice, that's great. Thank you, guys. So, Tim, we might go back to the presentation. Thank you. And we might move on to the next slide. So, for our midwives and our double degrees, we'll also touch on the streams available to them. So, if you are completing your Bachelor of Midwifery, you are eligible to apply to the midwifery streams. So, there is, as Emery had said, there's both a PMCV APS applicant pathway, which is just your midwifery stream for January or February and your midwifery August stream. And then if you're not eligible to participate in PMCV, you can apply to midwifery through the PMCV APS ineligible midwifery stream, and that is a mouthful. So as part of your midwifery streams, the programs are 12 months long, and you do 4 3-month rotations, 2 of those in birth suite, 2 of them in postnatal. For our double degrees, at the moment, this program is under review with a possibility that it may be extended, but at the moment it is a 12-month program with 4 rotations, 3 months in length for each rotation, 2 in birth suite, 1 in postnatal and 1 in a nursing rotation. So for those grads who go to a nursing rotation, they tend to go to high acuity adult areas where they can cultivate and consolidate some skills that they can not only help them develop as a nurse, but that will also complement their midwifery practice. For example, at the moment we have grads in our busy colorectal surgical wards at Dandenong, up in our general surgical wards, in our respiratory and endo wards, in our cardiac wards here at Clayton, and in some of our surgical wards at Jessie Mack, just to name a few. And these grads, we do get fairly good feedback about these rotations because the grads take back such valuable skills from these high acuity adult wards back into their midwifery rotations when they go back. So with our midwifery, the way that it's structured, many of you who've done placement here will know that Monash Health has midwifery based at Monash Clayton, Dandenong and Casey, and at each site there is teams of midwives and they're named after gemstones. So here at Monash Clayton we've got opal and amethyst and topaz. At Dandenong they've got turquoise and rose quartz, and at Casey they've got sapphire, ruby and diamond, to name a few of the teams. So when a graduate comes to Monash Health for their midwifery or double degree graduate year, they're actually allocated into one of the teams at one of the sites, and they stay in that team for the duration of their program. And that means that they actually get great continuity with their midwifery managers, because that person looks after them for the whole year. They do move, when our double degrees move, they do move under a nursing manager for their 3 months, but then they're usually going back to their midwifery team managers. So it's great to see that we can offer that sort of continuity and support, and the grads really get to know their managers, especially because they've got such short rotations. Anything else we want to add, guys? No? We might move on, Tim. Thanks.
So moving on to what support we are able to support, provide the grads during their year with us. So as Jo has mentioned in her introduction, Monash Health does have quite a big graduate program, and obviously in the response to us, the NAMES, which stands as our education for nurses and midwifery team, we've had to respond to ensure that we have adequate support. So we do have on the floor itself quite an extensive and dedicated team of nurse educators, clinical support nurses, clinical coaches, and we also, like, apart from that, we also have like your operational managers as well that provide that support, along with your colleagues, like your ANUMs, your preceptors, your buddy nurses, your mentors. So these are guys that the grads, and in fact all of us can go to for support during your grad year. So just kind of going around this this slide. So starting at the top, we find that we have been very lucky because of the resources that we do have here at Monash Health. We're able to provide a very detailed and very comprehensive graduate orientation. Normally, before the COVID-19 situation, this was a 2 to 3 day orientation, which covered not just your specifics, but also your corporate induction and also orientation to the graduate program itself. So it was quite detailed. extremely detailed and quite comprehensive, we feel. This year, obviously, we've had to change a few things. We've been quite lucky that we've been able to provide an online virtual orientation program. And so the feedback that we have received by our orientation, that it has been very detailed, and we have lots of support, not obviously from just from the grad team itself, but also from our colleagues within the wider family of the educational team. And because we have such diverse rotation opportunities, at a local level too, you have that clinical support that the managers, preceptors and clinical nurses can provide to you as well. As part of the programme as well, we do have, the grads do have attend a minimum of 5 paid graduate study days. I love saying that word paid, because you get paid, you get money into your bank account for study. And this is really a fantastic feeling, I'm sure. But all joking aside, this is part of our curriculum that that the grads have to attend. And again, the educators who are leading these study days have spent a lot of time to ensure that all education provided is evidence-based. So you basically do have your 5 study days, but obviously some areas, say for instance, peri-op, pediatrics, what else? Cardiac areas, ICU, ED. You may have additional study days as well that you would have to attend. So obviously you would get further information as and when you start your rotation. Supernumerary time, we can guarantee that for each rotation that the grads go on to, you will get a period of supernumerary time. So for most part, if it's a general ward, say surgical med, you would get at least 2 days for each rotation of supernumerary time. And those specific clinical areas, say for instance, again, like ICU, peri-op, ED, your supernumerary time would obviously be designed to fit in with that particular area. So sometimes it can be quite extensive. Again, that's something that your manager and your educators will obviously explain and provide you with a comprehensive timetable with regards to your supernumerary time. As I did mention before, we do have a dedicated clinical education team, and obviously their whole purpose is provide support for the graduates during their programme year. Again, we do try to make it person-centred to a certain extent, but there's certain things as an organisation that educators do have to provide to all employees. But we do try to tailor to fit your needs. And again, it's having that open communication with your educators is very important. Within your grad year, we do, as part of our curriculum, we do ensure that grads have dedicated debrief and tutorials as well. And these are run at all the different sites throughout Monash Health. And normally it's run on a weekly basis. And again, because of this year has been slightly different because of our current situation, I am proud to say that in the majority of cases they've either done WebEx debriefs or, we've had smaller debrief groups. What I'm trying to say is obviously we recognise how important these debrief sessions are to our grads, so it's something that the education team have really tried to continue during these difficult times. We also do have an opportunity, and we do have a number of grads who are participating in the honours programme at the moment, and some of the topics are very interesting. And again, what we like to do in cases like that, if you were interested in doing honours, obviously we'd be directed to the correct people to speak to. But also we find that the grads who've been doing the honours programme, they're more happy to talk to you about, any tips, any tricks that they have when they try to incorporate this additional study during a difficult time, during your grad year. So lots and lots of different supports available for our grads throughout this time. And again, obviously, you do have post-grad opportunities on completion of your grad year, which again, your educator and your managers will be able to provide further information if you're interested in a particular area. So maybe move on to our next slide, Tim, please.
That's me. So I'm going to talk a little bit about the mental health graduate program. I guess before we do start, it is a 2-year program, so it does differ from the other streams. So the first year is a graduate year and the second year is a postgraduate year. There is an expectation that you have to enrol in a Masters of Mental Health Nursing. Our EBA does stipulate that to work in mental health, you have to have a minimum of a postgrad diploma. So this is why you need to enrol in a Masters. You can exit at a postgrad diploma. So just putting it out there now. So what's on offer? We, just like any other nursing area, mental health also cares for people from birth to end of life and everything else that's in between. And Monash Health is one of the largest mental health services here in Victoria. We have, I'm just having a look at some of the pictures up there. We do have a perinatal inpatient and infant unit here at Clayton, which is 6 beds. Then we're kind of moving up age-wise. Then we have Oasis, which is here at the Children's, and that's our neurodevelopment ward that houses 6 people or 6 children and their family members as well. Then we move on to our Stepping Stones, which is our child and adolescent inpatient unit. We have many adult acute inpatient units. We have community care units, so psychosocial rehabilitation. And as you can see, there's a picture of a dog on the screen, and that is Lacey, the resident dog who lives out at Doveton Community Care Unit. So she was purchased from the Lost Dogs Home, or from the Pound actually, and has been with Doveton Community Care Unit since she was about 10 weeks old. And as you can see now, she's quite a large dog. It's the residents who actually care for Lacey, walk her, feed her, take her to the vets. They took her to puppy school when she was young. Yeah, so they've really enjoyed having Lacey as their resident pet. We also have our acute aged inpatient units as well for clients that have a dementia, Alzheimer's, as well as a schizophrenia, depression. We also have our dual diagnosis, our dual disability team, which is out at Narre Warren, and our dual disability I've already said that, haven't I? Dual diagnosis, sorry, area out at Dandenong. So, we have a large range of areas that our graduate nurses can also go to as well. Next slide, please, Tim. Can I get you to click it again, please? Thank you. So I guess what you can expect, it's very similar to the other streams. We have an 8-day comprehensive orientation program, and this is why you start 2 weeks before the February date. So there are certain workshops that you need to attend prior to actually commencing on the wards, and this is around our sort of clinical risk training. It's around suicide prevention training. So there's a lot of things that you do need to do. So as you notice, this is why you start 2 weeks earlier. Each of our educators are allocated to one of the bed-based services, so that's our inpatient units, who you will also receive support from. When you're allocated to your area, you'll normally get allocated 2 preceptors, so in case one's on annual leave or one's on night shift, you have access to another one as well. Just like in the other streams, you'll get 2 supernumerary days, especially within your first rotation, and depending where you go, so if you were going to our drug and alcohol withdrawal unit, you will actually get 5 days supernumerary because it is a very specialised area. You will also be invited to and able to attend sort of the weekly in-services, as well as what we call debrief sessions, but we do call it a little differently in mental health. We do call it supervision, and it's a reflective space. So it's protected time for nurses to be able to talk about maybe some of the complex clients that they might have, and be able to kind of, nut out or unpack it, and look at what other options there might be, and it's a very supported, confidential space for staff. as like the other stream, you also get paid graduate study days. I'll reiterate, Anne-Marie's paid. So these paid study days, you actually have 11 of these study days. So the reason why we have 11 study days is because one of the units that Monash University teach into their master's program is basically what our study days are based on. So you don't actually have to do that unit at university because you're actually doing it through your graduate program, and that you will also get 12 credit points towards that. You also have access to Monash Health in-services, short courses on our Latte system. You also have access to you also have access to other online training. We have a mental health professional online development platform that any person working in mental health, it doesn't matter what discipline you are entitled to register and complete any of those courses. You also have access to the Centre for Mental Health Learning, which I don't know if they can hear that. The Centre for Mental Health Learning also offer courses for any person working in mental health within Victoria. So there's lots of different things on offer for everybody. Next slide, please, Tim. And I might go again, please. Oh, the sponge.
The old sponge.
The old sponge. So my one hot tip for you all is to be a sponge. I don't think I will explain it. I don't think it really matters what sort of field of nursing you go into or what job you go into. You know, you need to always remind yourself that your brain is a sponge, that you need to absorb as much information as what you can and what people are willing to teach you. But at the same time, desorption is also really quite important as well. So the point about absorbing information is to actually teach other people the things that you've actually learned. So what that will do is give you more room in your sponge/brain to actually bring on more information as well. You know, when you do go through 4 rotations within the mental health program, you need to give yourself room to pick up lots of different skills from each of the different areas. So you need to take on knowledge and you need to provide knowledge to others as well. So that's my little tip. Next slide, please, Tim. So the mental health program has been fortunate enough, it was probably last year actually, we got given some funding from the Department of Health and from the Office of the Chief Mental Health Nurse for community positions for our graduate nurses, and we were able to actually have 17 of our graduate nurses be able to work alongside some very experienced clinicians within the community and looking at, you know, how the role of the community nurse versus the role of the nurse that works on an inpatient setting. The funding did stop, but the funding's now come back again, and we now have a permanent community position for our graduate nurses. So rather than sending one graduate nurse out for a 12-month period, we're actually going to be sending 3 graduates out every 6 months. So you'll get 2 months each within a community team. Now, those community teams can certainly be our CAT teams, so our community and treatment teams that go out and see clients, trying to keep people out of hospital or to come in and assess clients. There's also the opportunity to work with our PACER team. So that's our police, ambulance and community mental health team who go out together. Yeah, so there's lots and lots of different community areas that are more than happy to facilitate grad rotations for 2 months. Next slide, please, Tim. Anne-Marie.
Thanks, Shelley. Excuse me. So this slide just is referring back to, we do have obviously a number of our Aboriginal and Torres Strait Islander graduates with us at the moment. And so obviously, just a funny story with this photograph, I meant to say it the last time. So Tracy on the right was one of our program members, our team members, and she actually won the Hester Award about 2 years ago. last year. Was it last year? So Tracy is a midwife. She's still working with us here at Monash Health now. So we're very proud of her. And then the other picture is one of our grads who just finished last year as well, who was very keen to stay with us, but her family moved out to the countryside somewhere, and she's now working in the rural community. We do hear from her from time to time. She's having an awesome time, and she was a really good mentor to our grads while she was with us, and was part of our representative group. So really a great contribution to the group. So as I say, going back, we obviously have a number of our grads, and it obviously to contribute towards the cultural diversity of our grads and our workforce here at Monash Health. And one of the aims is obviously to create and to develop stronger links to the Aboriginal community, obviously within Melbourne. And within this programme, on top of the normal study days that we offer, we do have an opportunity to provide dedicated support and cultural support study days, I meant to say. So things like the Ironing Circle, which we had started last year, then again, unfortunately, due to the COVID situation, we've had to kind of put in a back burner, but there's a group of people who are extremely keen to get this up and running again when it's able to. And we've had good feedbacks with regards to the Ironing Circles. And again, we do have an opportunity for our grads and our cadets as well, because we do have a cadetship program that's currently in progress as well. We do provide an opportunity for our grads and cadets to attend the Catsingham conference. Unfortunately, not this year, so that's off the table. But hopefully next year things will get back to normal, and we'll be able to offer those places as well, because apparently it's a great opportunity to network, learn different things. We've had really good feedback from those conferences. I think really at this time we also have another polling question. So I think if you guys go to your app on the Slido, I think a question should be coming up, whoever's in charge of that, because obviously not me. Yeah, what year? So what year are you currently completing your undergrad studies? So obviously what to be expected, 3rd year, 4th year? Couple of 1st year, 2nd year. Okay.
Fantastic.
Code Blue Adults, Monash Medical Centre, Outpatients Clinic N.
Sorry,
Code Blue, Monash Medical Centre, Outpatients Clinic N.
Sorry, guys, for that disruption. Unfortunately, this is a working hospital. It's only to be expected. So, yeah, just bear with us.
Fantastic. It's good to see all of our 3rd years here on the ball, getting ready to apply.
Yeah,
and
good.
our 4th years. And our 1st and 2nd years.
Got a couple?
Yeah, very organised.
Okay, so just moving on maybe to the next slide, because I'm a bit conscious of time. So obviously, this is just, again, a very, very brief slide with regards to how to apply to the graduate program here at Monash Health. So as you can see, we have the PMCV allocation applicants. So guys, it is really important, and you would have already, hopefully, had a look at the business rules when it came to the PMCV application. So it's really important, guys, that you register and create an account with PMCV APS, again, bit of a mouthful. And obviously, you need to add the Monash Health program streams if it's part of your preference list. So you need to go on, create an account, and then put your preferences in. Along with that, it is also important to remember that you do still have to create an account here on Monash Health eRecruit website, and as you can see, that's the link. But this information is on our application guidelines, may even be in our template, it's in our booklet. So it's really important that you guys refer back to this as if it's your Bible. So you do need to do two things: PMCV register and then create and then apply for the job advert for the graduate program. You may not believe us, but in the past we have had people that maybe only done one, has applied for the PMCV, and then they may have automatically thought that that they've applied for the position here at Monash Health, but you have to do both. So please, make sure you do that. If you don't take anything away from today, that's two things that you have to remember. Moving on to the group of applicants who are PMCV ineligible. Obviously, you guys are not able to go through PMCV. So, however, you will have to go on to our Monash Health eRecruit website and again, create an account, and then you apply for the position using the computer match ineligible job advertisement as we have on our website. So, and then obviously you fill in the same template that the PMCV eligible group of applicants can do. You just fill the template in as you would normally do and then submit it and follow the instructions as we have laid out in our guidelines. So, as I said before, it's quite simple, but sometimes those wee steps, some people tend to overlook them. So, look at our application guidelines. We provide a lot more information than you see here in the moment on the presentation. Make sure you read through it and then follow the instructions as directed.
Sorry, Anne-Marie, just for your information, the Mental Health Graduate Program advert is on its own. So it includes those eligible for PMCV and those ineligible for PMCV. You just apply to the same advert. Thank you.
Thanks, Shell. So we'll just go on to the next slide, Tim, please.
So as Shelley touched on, you were quick off the mark. As Shelley just touched on, when you go on to the Monash Health eMercury on the 13th of July, because that's when our job ads are opening, you will see 4 graduate job ads that will be available. One for the PMCV APS nursing streams, one for mental health nursing, one for PMCV APS midwifery and double degree streams, and then one for all of our PMCV APS ineligible nursing and or midwifery streams. So you can see there that the job ads have multiple streams within them, and that's because when you apply to Monash Health, you just put in one application if you're applying to the general streams. If you're applying to mental health, you would put in an application to mental health as well. But if, for example, I wanted to apply to let's say acute care and August nursing, I would just put in one application to the nursing job ad, and in my Monash Health application template I would tick acute care and tick acute nursing, and then in my PMCV I would rank the acute care stream and the August nursing stream. So one application for multiple streams. Same with the midwifery. If I was going to apply to the midwifery January stream or February stream and the midwifery August stream, I would just need one application, and I would just tick that on my application that I was applying for those 2 streams. So those are the 4 job ads that are going to come out that you'll need to apply to on Monash Health eRecruit. Can I have the next slide, please, Tim? So the big question, what do you need in a Monash Health graduate application? So a couple of years ago, our team put their heads together and reviewed our application process. And one of the things that we settled on was that nobody likes cover letters apart from mental health. But in the general stream, we decided that cover letters were very, very stressful for you. It was difficult for us to assess, and it seemed that no matter how prescriptive we were in giving you instructions on what we wanted in our cover letters, it was very difficult for us to actually get the information that we were after, which was kind of the same for resumes and CVs, and mental health did agree with us on that point. So in the general areas, in the general streams, so every stream apart from the mental health stream, we do not accept a cover letter. Please don't give us one. We won't read it. We won't even open it. But mental health, we'll ask you for a cover letter, and then for all Monash Health streams, please fill out our graduate program application template, which you can find on our website. It's live now on the How to Apply page, or else you can find that one attached to the job advertisement in the position documents section. So please make sure that you use your graduate program application template. It does include some selection criteria questions. Do not give us individual CVs or resumes. We will not read them. So please just make sure you use your graduate application template. We do ask for an official academic transcript as part of your application. We do appreciate that it won't be a complete academic transcript because you're obviously still completing your final years. Many of you will be able to download a PDF of your transcript through either a university online system or the eQuals system. We do accept those PDFs. So those PDFs are digitally certified by either your university provider or by eQuals. So we do accept those PDF copies. We do ask that you provide 2 to 4 clinical references, and I know that I'm speaking for everyone in this room when I say that references are the bane of our lives when it comes to recruitment. So if you're going through PMCV APS, you're going to have the opportunity this year to lodge 2 references in APS or PMCV. But in your Monash Health application template, there is also a space for you to nominate 2 additional referees. At the moment, it's not mandatory for you to give us 4 references, but the reason that we ask for 4 is because as part of our recruitment and the policies and procedures of our organisation, we must have at least 2 clinical references in order to offer somebody a position, whether that's through PMCV or whether that's directly to our APS ineligible applicants. And despite how hard we try, at the end of every recruitment round, there is always a very small stack of applicants who we would have offered a position to, but we can't because we cannot get 2 clinical references for them. Last year we went with the alternate reference approach, and we had a cut-off point where we did contact the alternate references, and we found that pile was much smaller than it had been in previous years because we were able to quickly access those alternative references. We do ask that you provide us with 2 summative clinical appraisals. So one of these may be from second year, and for the general streams, we ask that those appraisals are from either acute, subacute or critical care areas. So when we say critical care, that might be ICU or theatre or paediatrics. If you're applying to the general streams, please don't give us community or mental health appraisals. And for Shelley, I believe you guys asked for 1 mental health.
They only do 1.
Yeah. And the other just as an acute. So when you're submitting your clinical appraisals, we're just looking for your grading, the page with your grades on it, and the pages where your preceptors have provided you with written feedback and have signed that off. Please don't give us self-appraisals or extra written journaling entries or any of the 50-page marking guides that the universities send out to your preceptors. We really don't need all those extra bits and pieces. We just need the core clinical appraisals, and we do ask for the summatives. Those of you who are from ACU, you guys do a split placement, which means that technically your formative is kind of like a summative. If you are one of those ACU students, we do take that formative that you do from the first half of the placement as a summative, because then you move on to another area and get another appraisal done. I think that's graduate applications. Anything else you guys want to add? No? Can we moving on, please, Tim? So in closing, for the applications, this is probably the most valuable tip that we can leave you with. Our team sat down and wrote the graduate program application guidelines a couple of years ago, and we update it every year. And it's a really extensive little document that goes through exactly what you need to know about your applications, exactly how you'll go about lodging your applications and what you need to include. You treat this little booklet like your Bible. It's on the website with the application template, and it's also attached to the job ads when they open in the position documents section. And it really is everything that you need to know to make sure that your application is submitted properly and has all the bits and pieces in it that you need. And really, if you follow the application guidelines, there is really no reason why we wouldn't shortlist you for an interview. Moving on, please, Tim.
So just a brief discussion with regards to interviews, favourite subject. So obviously this year is going to be slightly different. In the past, we've held one-to-one and group interviews, but obviously it's not going to happen this year. So after lots of discussion with the PMCV, who have got the licence to use the Sunroute interview format, those guys who are eligible to go through PMCV, you will be receiving an email and a link and information about how to go about performing a Sunroute interview. Some of you guys may have gone through this process before, and we've had good feedback with regards to this. So you will have an opportunity to practice as such. You will be given the questions and you have an opportunity to practice it. And then you will be directed to upload your final responses to the interview questions. But those guys, so that's for the guys who are planning to do PMCV. For those applicants who are not eligible to go through PMCV, you will also be going through a Sunroute interview as well. And this will be sent out by us, by our recruitment team and also our grad program team. So the questions will be the same, the process will be the same, the selection criteria, review criteria will be exactly the same as well. It just means it's coming from different sources, one from PMCV and one from Monash Health. And then obviously we will get back to you with regards to, the outcomes sort of thing. Mental health obviously is going to be slightly different. I do believe that they will be running face-to-face interviews. Is that correct, Shelley?
That is correct. So all mental health interviews will be face-to-face. You will not receive a link from Monash Health in regards to a Sunroute interview format. I may have a look at the PMCV Sunroute interviews, but it will be face-to-face for us for mental health.
But in either way, you will be getting further information either from mental health stream, but definitely if we're sending it for the Sunroute, both from PMCV and from Monash Health, you will be getting information about how to go about it and recommendations and tips and tricks sort of thing. Moving on to the next slide.
So just some things that we wanted to leave you with. I think in this room, I think we've got about 15 years of experience doing graduate program recruitment, and but mostly no, and I think between us, we've all screened and interviewed thousands of graduate applicants, and these are the things that really come to the forefront of our minds when we're thinking about graduate program recruitment. So firstly, please do not use your university student email address to apply for graduate program positions. If you don't have an appropriate one, so for example, like kawaikitty69@hotmail.com, go and just make another one that's just sort of first name dot last name at Hotmail, Yahoo, Gmail, whatever, and use that to apply for your graduate program positions. The reason that we ask you to do this is because your universities have very stringent firewalls that really don't like emails from .org addresses, and the majority of the health services have .org email addresses, and it's very, very common for emails from us to universities to get caught in the firewall and deleted before they even reach your junk mailbox. So please do not use your university student email address for your applications. On that application track, make sure that you don't leave your applications to the last minute. The Murphy's Law says that if something is going to go wrong, it can go wrong. And, you know, you don't want to be that person on the last day who's trying to get their application in, and obviously all applications are online, and then the system crashes or your internet goes down or something like that happens. As we've already said, read those application guides, read those application guidelines really carefully and follow those instructions. In our application template, you'll notice that there are 3 short answer questions. They do count towards your overall application scores, so think carefully about them and answer honestly, because it's part of how we get to know you as an applicant. Emily?
Yeah, just kind of finishing off with regards to your sunroom interviews. I mean, it is an interview, you know, by all means, even though you're doing it in your living room, but be aware of, because we're very much aware of background noises that's going on now. But so when you do your interview, your sunroom interview, make sure you go somewhere nice and quiet, that's got good lighting. It's not in the kitchen where the whole family's coming in asking for their chips, and the dog's barking, or the cat's trying to jump on your head and stuff. So be mindful of your environment. Make sure you prepare everything, that your computer's working, your mic's working, the webcam, everything's working, and you know, dress appropriately. You know, we do appreciate, like, you're not coming in to do a face-to-face, but we really do not want to be seen in your PJs. It really isn't a good look. So you come for an interview, dress appropriately, and again, use that practice time to go through those questions. That's why we allow you to have that practice time. We want you to be successful. We're not setting you up to fail. So take that on board, and you look at the questions, you look at the instructions, and try and follow them as best as you can, and maybe even speak to some of your other friends or colleagues who's gone through it before, and what would be their tips and tricks. And maybe you know, some of your other guys, friends may have done this before, and ask them what's been successful for them. So just prepare and practice. I wish I could think of another P, but I can't. But there you go.
Okay, in closing, I think we've got one more question for you before we hand over to Mel and our graduate panel. So I think that question is about what are you most looking forward to? And I can see that some of you are already all over it. 3% of people are really honest.
I like the 3%. 3% can come work with me.
4%. Now everyone's like, oh, it's okay to answer that. But yes, the majority of you, clinical judgment. Yeah, that's a big one.
That's good.
That's great. Thank you, guys. All right, now we're going to hand over to Mel and our 2020 graduates. Welcome, guys, to do our graduate panel, and we will see you guys in about half an hour.
Thank you. Can everyone hear me? Yes? Okay, so I'll just be facilitating the Q&A for the next half an hour. And with me, I have 5 of our current graduates who have volunteered their time to be with us this afternoon. So we really appreciate them putting themselves forward and helping us out with this. So we are in the background receiving lots and lots of questions. We will start off with the graduate questions once we finish that one up, then we'll move on to the questions for the managers because there are a lot of questions here. So firstly, I'd like the graduates to please introduce themselves.
Hi, my name's Paige. I'm in my first rotation in the complex stream, and at the moment I'm currently working on the cardiothoracics and respiratory ward at Monash Medical Centre. Something that stood out to me about my grad year so far is probably the support that the sort of the ward community has as well for you, like not just the educators and everything, but all the other staff on the wards. Yeah.
Hi guys, I'm Steph. I am in the August stream of graduates. So I started August last year, so I'm currently in my second rotation, about to finish. My first rotation was at Dandenong on a general medicine, respiratory and endocrinology ward, and I'm now at Monash Children's in special care nursery. Have the rotations exceeded my expectations? They definitely have. I wasn't expecting Monash to be able to provide so much opportunity and so much support as a graduate. I came in very nervous that I would fail miserably and look like a fool, but I guess that with the help of everybody here, I've not done that.
Thanks, Steph. Grads, we'll get you just to introduce yourself and then we'll move on to the questions. So that's all right. We'll continue on. Kayla, could you introduce yourself, please?
Yes. Hi, I'm Kayla. I'm not sure if my video is working, but that's okay. I am a grad in the complex care stream, currently on my first rotation in KCED, and will be rotating to the children's theatres for my second rotation in August. Thanks, Mel.
And George, can you please introduce yourself? You're muted.
Sorry. Hey, can you guys hear me? Hey, so I'm George. I'm one of the mental health graduates. I started in 2019. So I guess the 2019 program was 18 months. So I'm currently in my third rotation and finishing up that. Yeah, currently working in adult mental health on one of the acute wards in Clayton, and then moving on to an acute youth ward in Dandenong.
Thanks, George. Nicole, would you mind introducing yourself, please?
Hi, my name is Nicole. I was in the Midwifery August stream last year, so 2019, so that puts me in my fourth rotation at the moment on the postnatal ward, and I've been in birth suite as well.
Thank you. So we'll get started with all these questions. First up, Paige, you did touch on this one already. Was there anything that stood out to you that made you choose Monash Health over another organisation? Do you have anything to add there, Paige?
Over another organisation, I guess something that stood out was just like how diverse the areas of nursing that you get to work, the options you have, I guess. So, yeah.
Lovely, thank you. And next question, did you feel you had a good chance at getting a position with Monash Health? Nicole, could you answer this one, please?
I did feel like I had a good chance without sounding too arrogant. I've done a lot of my placements with Monash, and I felt like the preparation before that really helped prepare me for the application process. But that's not to say you don't have to do placements with Monash. I know a lot of the grads at the moment didn't even do a placement with Monash before applying. So yeah, I felt like they were taking a big intake.
Perfect. What has been the most challenging part of being a grad? George, could you answer this one, please?
I can. I think transitioning from a student to a grad, I think the most challenging part was, I guess, the lack of experience, and, you know, going from a mostly general undergrad course to, you know, completely mental health stream. It was challenging. But, you know, with the program at Monash Health, you can overcome it, you know, with all the support. There's a lot of education. So if you're lacking in areas, you can always build up that knowledge really quickly. But yeah, the biggest thing I found was that all the teams are really supportive, and they know that, you know, they've all been in your shoes, so they're very understanding, supportive, and they really help you through.
Wonderful, thanks, George. We may as well continue with support now that we can see Kayla. We can see you now on our screens. How supported have you felt? Could you take this one, please?
Certainly. So since I've started at Monash, I've felt really supported the whole way through. We started off with some orientation days with the graduate program team, just to get us settled in and know what we're doing in regards to Monash Health. And then when we went to our wards or specialties, me being an ED, I got further specialty study days just to get us set up for what the ED environment will be like. And then furthermore, we had supernumerary days, and we also had, in ED, we had 50% workload days. So we'd share 50% of the workload with another grad. So I did feel really supported. And even after all those 50-50 days, and then we're on the floor by ourselves, still supported. You can always ask questions. The educators are really good. The CNSs, preceptors, even the TSP or the other grads. I haven't felt unsupported at all through any of my shifts. So it's been really good. Thanks, Mel.
Thanks, Kayla. Great answer. And Steph, you did touch on it. Have the rotations exceeded your expectations? Did you have anything to add there?
No, I think I touched on it all before. I was pretty happy with how both rotations have gone. I wasn't expecting them to be so supportive, as well as giving me the opportunity to do so much. I was able to learn extra skills and become confident in, you know, my peripheral IV cannulation, and as well as my tracheostomy care as well, by being on the respiratory ward, something that I wasn't expecting to be able to do in my first 6 months. That's all. Thanks, Mel.
Thanks, Steph. We're flying through these questions, and it's looking like we're getting quite a few questions directed to the managers. So please feel free, if there are any questions for these guys, jump on Slido and post them for us. Moving on to the next question. How was your transition from student to graduate nurse? We might get a response from two of you. Nicole, from a midwife perspective, could you answer that one, please?
I think it was actually quite smooth. I think everyone was so helpful. There was so much support, especially in first week. We had 2 weeks supernumerary. I remember saying to one of my buddy midwife on my last day that I was so scared to be alone, and she told me, "You're never going to be alone." And from then on, I was fine. Like, there's always someone around to ask questions, and it was just smooth. It just felt so natural.
Perfect. And Paige, could you just give us an insight into your transition from student to graduate nurse, please?
I agree, like it was very smooth. On the ward that I'm on at the moment, the cardiac 6 respiratory, initially we only had 2 supernumerary days, so it wasn't that much. And I was, after my second supernumerary, I didn't think that I was ready to be by myself. Like, I was still double checking meds like I was as a student almost. And but then our preceptor that we got allocated to for our 6-month rotation, she was like, "Don't worry, like there's always going to be someone around. Like, you're never not going to have someone to help you if you need help. So just as long as we're asking the questions, there's someone that's there for us." Yeah. Thanks.
Awesome. Thanks, Paige. Kayla, I will give you the next one if I can. Would you recommend Monash Health, and what are you most satisfied about Monash Health?
Yeah, absolutely. So yeah, I definitely would. Monash Health has been really great for me. It's been a really good experience. The thing that I've liked the most, I think, is the opportunities that they give the grads. Like, we've been able to do you know, the specialties that we've preferenced and whatnot, whereas some hospitals are a bit like scared because we're grads, which is fair enough. But I've really liked the support and the opportunities that we've been able to be given at Monash. Thanks, Mel.
Thanks, Kayla. We have touched on the next one a little bit, but what support did you receive both emotionally and nursing-wise when you encountered a difficult situation? Just looking, Kayla, I might continue with you here, given that you're rotating through ED, and you may have come across a difficult situation.
Yeah, I have had a few difficult situations, but as I said before, the support in ED is phenomenal. You're always buddied with a team leader, so someone that's more experienced than you and your go-to person if you know, you feel like you need to talk to someone or whatnot. And there's always educators or nurses in charge. There's always people around. Believe it or not, you've just got to speak up when you feel like you're out of your comfort zone or you feel like you need a debrief. There's definitely always someone there for you. Thanks.
Thanks, Kayla. A question for Nicole. We've got a couple here. What have educators said to you about gaining new competencies in cannulation, water birth, and staying on after your grad year? So your ongoing employment. Can you give any information there, please?
Yeah, so I have been offered ongoing employment already, so that's already in the process at the moment. I've also the other day just had my discharge examinations signed off for newborns. I am planning on doing the cannulation course, but just because of COVID, that's put a halt to that for the moment. And I've already got 2 water births, so I'm nearly one off being fully able to do those by myself.
Very good. Thank you. There is another one for you, Nicole, while I've got you. Wondering how your midwifery grad workload is. Is it disappointing to not get AN, so antenatal or special care nursery time?
So the workload is kind of heavy, but considering that it's direct, I've just done 6 months postnatal, 6 months birth suite, which I feel has actually been really good to wrap my head around those areas. And now that I'm feeling more confident, I've already been talking to my manager about transitioning to antenatal clinic once I've finished my grad year, which I'm looking forward to as well. And special care nursery doesn't bother me as much just because I personally didn't enjoy it too much. But yeah, I know for some people it probably is a bit disappointing that we don't go there.
Oh, thanks, Nicole. George, there's a question here for mental health. What made you choose Monash from a mental health perspective?
Good question. So I think for me, there was a few things. Well, the program was 18 months, so I guess I was going to get more experience in different areas of all the different mental health facilities. And, you know, the program was, you know, they were promoting it as very supportive, you know, one of the most supportive programs in Victoria. Just to let you know, I would say it is the most supportive program. I've never felt unsupported through my whole 18 months here at Monash Health. What else? It's also one of the biggest mental health organisations in Victoria. So there's a lot of room for growth, a lot of room for opportunities like this, a lot of, you know, areas to work in after your grad year. Hint, hint. So yeah, I highly recommend coming, mate.
Good. Thanks, George. Yes, there are lots of opportunities which Joe touched on in the welcome. So awesome. Steph, I need to fire one at you. What is your favourite part about being a grad at Monash?
I would probably say the opportunity that I had to have so much option in where I wanted to rotate. I guess being able to obviously pick here, I picked Monash as well because I knew that I wanted to end up working with neonates. And I knew that even if I didn't get it as a rotation, being my first or my second, that Monash provided support and opportunity to be able to apply for that and work towards that goal. Yeah, it's been really good, really. I like everything about it. I'm glad to not be a grad though in 4 weeks' time. That'll be good to be over, but yeah, I'm staying on, which is exciting.
Yeah, very good. Yeah, well done.
Thank you.
Paige, how did you manage transitioning to night shift? We do have a couple of questions around night shift here, but how did you manage transitioning?
For me, when we did our first night shift rotation, the ward I was on, we didn't do any supernumeraries. However, they buddied us with a more experienced nurse, and they also gave us for the first few nights and a lighter workload for night shift. So on the ward I'm on, we can have up to 8 patients on night shift, which is a lot and can be kind of scary. But initially I think we were just having 5 or 6, depending on how busy the ward was, and then slowly easing us into working on nights with like the full patient load. So yeah.
Yeah, so the next question was, are grads allowed to work night shifts? Yes, they're very much allowed to work night shifts, which you can all probably nod. Yes, every area you've been to, you will most likely be put on night shift. Kayla, here's a question for you. Before starting in ED, did you ever feel like you were not ready or that you wouldn't have the skills to be in there, transitioning from a student so soon?
So I was fortunate enough to have a placement in ED in my final year of studying. And that's why I did preference it as my first one, because I enjoyed it so much. In saying that, I feel like even having the 5-week placement, I was still really nervous starting out. And, you know, it's a big thing, ED. But if I can just recommend that you just get your basic skills down pat and your doctor's ABCs, you will seriously be fine, because the support you have is really great. And they do start you off slow. They start you off, you know, lesser patients, not as thicker patients. So they do really support you in that aspect.
Thanks, Kayla. That one's done. Can grads undertake further training such as IV cannulation? Kayla, this one's probably more directed at you again.
Yeah, so being in ED, that was actually part of our study day, learning how to cannulate, because it's basically one of the most important things in ED. We do cannulate a lot of our patients. If we don't cannulate, we're just doing venipuncture. So they did teach us, but it wasn't the main priority when starting out. They made sure we were okay with our documentation and okay with our assessments on our patients before they got us fixated on cannulating. But yeah, it's definitely something that you can do as a graduate.
Great, thanks, Kayla. I will get a few different responses here because I am curious as well, and I think all of you could answer it very differently. But Steph, we might start with you. What was your first day like as a grad?
My first day was very weird. I was excited, but also very, very scared. And I remember being in this mindset of I'm a nurse and I'm registered, but I still felt like a student, especially when having your buddy days. I still remember walking out to the corridor with some Panadol, and I was like, are you sure I can give this Panadol? Who am I telling that I'm giving this Panadol to? And everyone was like, no, you can give Panadol. You don't have to tell us. You don't have to get anyone to check it. Being a mid-year student as well, I did my last semester of uni in, I guess, what you would call semester 1, so when all the Feb grads had begun. So I hadn't done any placement for over a year because I had the luxury of being able to kind of fix my timetable up with my uni that I was at. So it had been over 12 months since I had done any placement. I had never done placement on a medical ward. My last year was specialties such as ED, special care nursery, and PACER and ED for mental health. So I think that on top of the fact that it had been so long was really, really scary because I felt that I didn't know what to expect whatsoever. But I think it took about a good few days or a week and it was good. I was just doing what everyone else was doing and I realised I had this and so did everybody else, and it just came naturally, like, as they say, riding a bike. Just happened overnight and it went good from there. Thanks.
Perfect. Thank you, Steph. Nicole, from a midwife perspective, how was your first day?
I would say it was very much like Steph's. I did still feel like a student in just the first day because, you know, you have the buddy midwife and you don't actually, I don't think I took a patient load on the first day. I was just working with it. And it had been over a year since I'd been on the postnatal ward. But it was good. I felt like the first day was just a million different people coming up to me and introducing themselves and just kept saying, if you need anything, just ask me. And it was great. I loved it.
Yeah, good. And George, mental health perspective, how was your first day?
My first day was really interesting. I loved it. So it was in a community care unit. So I remember like walking in thinking, have I got the right place? Are the staff nice? Are the patients going to be nice? You know, what are they like? Yeah, I went in and I felt, you know, really at home. Everyone was really nice, really supportive, and you just go through baby steps. The first couple of days we learned what the normal processes were. You got to meet all the patients, really got to engage with people as you do in mental health. And yeah, I loved it. There's probably one of my favorite I guess first time experiences.
Yeah, good. Yeah, thanks, George. Paige, can you answer this one? How many days a week do you work as a grad, and have you found this is too many, just right, or not enough? So I think they're looking at work-life balance. You can answer that
So
one, please.
at Monash anyway, we base it in fortnights. So it's not like per week. You do 8 shifts a fortnight. So depending on how the roster is, you could get like multiple days in a row, but then you'll get multiple days off as well. So sometimes actually on my ward I end up with 6 in a row, but then I have 3 or 4 off, or sometimes I do only 2 and then I have 2 off and 4 on and another 1 off and 2 on. So it's just sort of dependent, but you can do your scheduling and try and fit it in, and they do try to accommodate you. Well, that's what I found anyway, to what you need, and like if you need a shift swap, they're very accommodating and stuff like that as well. So the roster, because it is rotating, is just dependent. I don't think I found it too many either. I think it's been pretty all right for starting out doing 8 a fortnight. So yeah.
Cool, thank you. Kayla, do you have any interview tips?
I guess just be yourself and smile, look interested, and just ask questions that you are unsure of. No question is stupid, really. And I'd say don't be too overpowering. If you're still doing the group 1s this year, I'm not too sure if you are or not, but thank you.
Thanks, Kayla. Yes, it is a little bit different with the COVID-19 situation, so it could be very different to last year. The best tips for starting as a grad. Steph, could you please take this one, please? Best tips for starting as a grad.
Best tips. I would probably say just being self-aware and being honest with yourself and the others around you. If you're not sure on something, it's okay to ask. I still remember, because I'd never worked on a medical or surgical ward as a student, I still remember my first week and I didn't know how to clean a bedpan because I had never had to use one as a student. I just got really lucky. Asking for help when you need it as well, and just being aware of what your scope of practice is, and if you're not sure, just double checking. Thanks.
Perfect, thank you. George, can you continue on with this one? Best tips for starting as a grad?
I think my tips kind of go along the same path. My biggest tip is ask as many questions as you can and always ask for help. Especially when you start off in acute areas, it's a very high pace, high pressure environment. And people are there to support you, but you need to ask for help. Because a lot of the time people won't know you're stressed unless you speak up. So that's my biggest tip.
Yeah, that's a good tip. So we've only got a couple more questions left before we move on to the manager's Q&A session. Excuse me. Steph, this one's in regards to special care nursery. Can you describe what it's been like working in special care, and have you felt supported? I think you have touched on the support, but if you'd like to just reiterate that, please.
So working in special care has been absolutely wonderful. It's such a special job to get to do, to be involved during these parents' most important times of their lives. In regards to the support directly with special care nursery, it's phenomenal. So you'll have a large education team that are rostered on AMs, PMs and night duties, Monday through to Sunday. So you will always have a minimum of 1 educator on, even when you are on nights and on a Sunday or a Saturday. Special care is also broken up into 2 wards. So you'll have Kingfisher and Sunbird. There will also be a support nurse on for each side. So although you've got a patient load of anywhere from 1 to 3 babies, depending on how unwell they are, you will also have a support nurse whose role for that shift is to help the maximum 5 special care staff on in that area. And they can be called in at any time. They'll generally be someone who is a CNS or has done the postgraduate coursework, so they are quite a senior staff member. You'll also have admit staff as well, who, when they're not going to admissions, are there to help too. Thanks.
Thanks, Steph. Paige, how can we prepare us for the transitioning to student to newly grad? Do you have anything else to add there? They're just looking for a tip on the transition going from student to RN.
I definitely think that making sure as a student, if you're still doing placements and stuff, making sure you're taking the full patient load, because once you're registered, even on your supernumeraries and stuff like that anyway, you're just thrown into having the full patient load. You don't get a choice. You have the 4 or 5 or however many on the ward it is, and it's all your responsibility. There's like, if anything falls back, it is on you. Like, there's no one that you can be like, oh, but my buddy nurse, like, no, you're the nurse now. So I definitely think, yeah, take advantage of your preceptor or whoever is asking you how many patients. I'd be taking all of them. Yeah.
Great. Thanks, Paige. And Kayla, how do you balance between your work and your life in regards to relaxing yourself as an RN? As RN is under the high pressure. So I'm thinking, how do you switch off after your shift and manage high pressure situations?
I think with me and ED, the grads that I'm with, we're actually really close. We've made a really good friendship out of all of us. So it's really good. We always debrief if we have a bad shift. They're always there. We're always there for each other. Me personally, I like to go to gym. It's just something that I like to do after my shifts. And yeah, just relaxing on my days off because, yeah, why not?
Yeah.
Thanks.
Yeah, thanks, Kayla. I'm going to, oh, there's another one. We might leave that. We're going to finish on this question here. What are your plans after you finish your grad year? Are you planning on staying with Monash? So we've got a few on the panel here who will be finishing shortly. So Steph, could you tell us your plans when you finish up, please?
So I'm finishing up in 4 weeks and I'll be staying on in the nursery. So I've already started to commence my postgrad course in neonatal intensive care. So I'm doing a 8-week pathophysiology course, which they do allow you to do even as a graduate. And then once that finishes, I'll move on into the NICU and continue postgrad studies there and hopefully stay there forever. Thanks.
Thanks, Steph. George, you'll be finishing up soon. What are your plans?
Yeah, so I finish my program in 3 weeks, and from there I've got a permanent position at Dandenong Hospital on Unit 2. It's the Youth Acute Inpatient Ward. So yeah, really looking forward to that. I've had a rotation there previously. Love working with the, your younger patients, and really starting their mental health journey on the right path. So yeah, looking forward to that.
Yeah, very exciting. And Nicole, I think you're finishing up also. What are your plans?
I'm also going to be staying, so I'll be just rotating now through birth, and postnatal day to day, and hopefully clinic. Antenatal.
Perfect. So you did manage to get ongoing employment though?
Yes, I did.
And finishing in 3 weeks?
Yeah, 3 or 4 weeks.
Yeah. Oh, very good. Nicole, just quickly, there is one more question. How many patients do you take in the postnatal ward?
So we take, even during the days, we take 4 women and obviously their babies, and at nights we take up to 6. But honestly, most of the time there's at least 1 or 2 that babies are in the nursery, or we have antenates that are counted in those numbers, so it's not always 4 and 4.
Wonderful. All right, well, that will conclude the graduate panel Q&A. On behalf of the graduate program team, we would like to thank all 5 volunteers. We really do appreciate you helping, and I think it's very informative, and we wish you all the best. And now we'll go back over to the team. Thank you.
Thanks, Mel. That was awesome. As I say, every year we've been doing like one form or another. We've been doing the expo, and I'm always like so proud and so impressed about with regards to our grads that we have here. They're so professional and caring individuals, and they really are. They show us how good our grad program is. It's not a reflection of us, it's a reflection of them. Yeah. So again, guys, on behalf of the team, we thank you very much.
Okay, so now we're going to move on to the Graduate Manager Q&A. Tim, are we able to get questions up on the screen in the main room? In the studio? Perhaps not. Perfect. Thank you. So let's start with, you're very interested in paediatrics. How hard is it to get a paediatric rotation? So, I mean, really, if you're talking purely about chance, then, you know, you get 4 preference options when you put in your application. If you go purely based on numbers, if you have paediatrics as one of those 4, you've got a 25% chance of getting a paediatric rotation. Really, it depends on the grad. Obviously, it's one of those things that, you know, you obviously have a shot to go in either your first or your second rotation. So even if grads don't go in their first rotation, they may rotate to paediatrics in their second rotation. However, we are an adult, we obviously are a big organisation where we look after patients across the lifespan, so we don't do just paediatric graduate years. We do make sure that our grads rotate to both an adult and to a paediatric area.
So the second question is with regards to our template. So I'm assuming it's an IT problem. Can we not access it? Is that what the issue is? Is it from your part? Is it from our?
Yeah, so I think in part 12 with the clinical area site preferences, some of you who are using Macs, particularly older Macs, for some reason the Word version in some of the older Macs does not like the automatic drop-down boxes. So if you are using one of those computers, you can just go in and just clear the field out and just manually type in whatever you want. So just select the box, delete it, and then you'll just be able to type in that space just like it's a normal Word document. Hopefully it should be quite easy for the majority of you, but every year we do have a small number of people who do struggle, who are on Macs and Apples.
I'm glad you answered that one, Stacey. Thank you. The second question is, what is the estimation of our grad retention? Well, I'm very pleased to say that, like, obviously since being in this team about 5 years, something like that, our retention rates hasn't gone below 94%, which is fantastic. I'm not too sure about mental health.
Yeah, no, we're pretty much the same. So we're up around, you know, yeah, between 90 and 100%. And every year after that, I redo it to, I mean, we can do retention after the grad program, but I do retention kind of, you know, each year after that as well, and it's still high. So
I think we do have obviously got a small percentage of people who do not stay with us. There's a variety of reasons. Some of the guys would maybe, if they're interstate, would head back home, or they come from the other side of the city, they would head back that way, or, you know, they may want to travel, do different things. There's lots of different reasons. But as I said, we're quite lucky that most of our grads, and as you heard, out of 5 of our grads, we have quite a small population, but out of that 5, you know, we do have 3 who already stay with us. So we've been quite lucky to have a high percentage of our grads stay with us.
So how many grads do we take in our acute care stream and how many in the complex care stream? So this is actually a really good question. So we are currently in the process of finalising our stream numbers for 2021 programs. As Joe has said, we will be taking 600 again, so maintaining our big numbers, and I think at this point we are the biggest graduate program. I know we're the biggest graduate program in Victoria. I think we may actually be the biggest graduate program in Australia at this point with our 600 grads. So the way that we break that down is kind of dependent on a lot of different factors. This year, to kind of give you a bit of an idea, we have about 135 to 140 grads in acute care, and we've got about 180 grads in complex care. We have in our August stream at the moment, we have about 160 grads. And then in our midwifery streams, we've got about 40 double degrees and 22 B-mids. So that's just the breakdown for this year. But our numbers do flex and change depending on the quality of our applicants. And obviously, when we're offering out positions, we do sort of keep in mind that not only do you have to be a good fit for us, but we also have to be a good fit for you. We are a big, busy, acute organisation, and you know, some people really, really thrive in environments like ours, especially with all the support that we offer. But as well, we want to make sure that that we are a good match for you as well.
Will there be an option to rotate the Monash Children's? Yes, of course. It depends obviously on your preferences, but it is important to remember that we also have paediatric wards and casing also in Dandenong. So as we mentioned before, because we're such a large organisation with different specialties at different sites, we do have that ability.
Sure.
Or do graduates have an opportunity to rotate in CAT and ECAT teams? Yes, there definitely is an opportunity if you are selected, I guess, to be a part of the 2-month community rotation. So the answer is yes, there is a possibility.
If there are any study gaps or fails in an academic transcript, could you address this with the team? Would it be appropriate to email the grad team? I mean, you can always email us if you would like, and when you do email us, we do add things into your application packs. Like, for example, let's say you're doing a 3rd year placement after the applications close and you get a referee from that 3rd year placement that you would like to use with your application, you can send us an email and we'll add that to your application pack. But when it comes to transcripts, here, I can't speak for other orgs, but obviously here at Monash, it just makes up a small part of your overall application. So when we're assessing your application and deciding who we want to offer positions to, we look at everything from your application template, your short answer question answers, as well as your transcripts, your clinical appraisals, the feedback from your referees, as well as how you do an interview. And we weigh each part of that. So that means that even though maybe you might have some gaps in your transcript or you've got some fails, that doesn't necessarily mean we just pick up your transcript and go, oh, this person's got 2 fails, that's it, in the bin. Life would be a lot easier for us if we did things that way, but we certainly don't. So even though you might perhaps lose some marks in the academic transcript section of your application, you might do really well in your interview, or you might have really good comments from your referees, and that will actually help to push your application up in other areas. So it's more about the overall rather than one part of your application.
If I'm accepted into acute stream after I finish grad year, is an opportunity to transit into the complex area. I mean, it depends really, to tell you the truth. That's not something that we can really address. It depends on the needs of that particular unit and obviously how you progress. I do, most of these guys are grads who would go into ICU ED after the graduate. A high percentage of them would go on to do the TSP. and I do know that those particular areas that you have to apply for those positions. Again, and some of the selection criteria could potentially mean that you've experienced like a grad rotation in those particular areas. So that's been the recent trend. But again, if you would be interested, we would be able to, or you would be able to maybe make an appointment to speak to the educator or speak to the manager to to see what interests you have and to see what the possibility. But to be honest, like it depends on the selection criteria for the job ad.
MMAX skills assessments for international students. So this is something that's actually determined by APRA. It's not actually determined by us. So when you apply for your nursing and midwifery registration with the Nursing and Midwifery Board of Australia, they will tell you whether or not they want you to sit an MMAX skills assessment, and that's something that you'll just need to discuss with them. We sort of don't have any input or sort of decision-making capacity in that respect. That's purely a registration and an APRA thing, yeah.
Next question is regards to the double degrees can work in both mid and nursing after the grad year. So we do have a number of grads who over the past few years have decided to do both. It obviously just depends what they want to do from themselves from a professional point of view. But it has happened in the past. Maybe they might do 0.4 in a nursing rotation and then the remainder of their EFT somewhere else during as a midwife. So yes, we're more than happy to support that, and obviously if the managers can support it, that's not a problem. But yep, it has happened in the past.
Do your clinical appraisals need to be certified? No, they don't. You'll notice that if you go onto the website, it's recently undergone an upgrade, thanks to Tim and the guys working in our public affairs department, and our new application guidelines and application template, as well as our new process, is now up on the How to Apply page. If you were looking at some of the older pages, you will have noticed that we used to ask for things certified, but we don't anymore because everything will be digital now, so we don't take paper copies of anything. So instead, with your transcript, we just ask that it's an official transcript from either Equals or from a university system, and obviously your clinical appraisals need to be on the official documentation, so whether these are downloaded from the online system that your university uses, or else it's some universities are still using paper copies of clinical appraisals. You would scan and upload those.
Next question, if you want to apply for complex and acute, would these be two different applications? So no. So when you get an opportunity, just look at the application template. You can see the part you can tick for whichever you're applying for. But however, do remember, if you're going to do PMCV, you will have to indicate or list your preferences. So you would put for a complex stream, acute, mental health, or August stream. Okay, so that's for PMCV. But non-PMCV applicants, again, the same process. Look at your application form, job application, and tick which, if it's going to be February, if it's going to be August, sort of thing. But it's pretty clear on the template and on the guidelines as well.
Does the interview process contain only one online interview and no group interview? So as we've sort of already touched on, the mental health interview process will be a little bit different from the general streams. So this year, for the general streams, we normally interview about 1,000 people in group interview format, but obviously due to the COVID-19 restrictions, we want to keep everybody safe, and we want to make sure that we're doing the right thing and supporting the community and maintaining social distancing. So as a result, for this year, we won't be doing any sort of group interview format for the general streams. We will just be using the online interview format. and then Shelley has already mentioned for mental health will be different.
Yeah, so we will be doing group interviews, obviously limiting the number. We do have a room here at Monash Health that specifies how many people are allowed in that room, and that would also include the people on the interview panel, obviously making sure that social distancing rules were adhered to, as well as hand sanitizer, wiping of any tables, and no sharing of any paper or anything like that. So it will just be all kind of, individual information. So yes, we will do group interviews.
I'm not too sure what this means, so I think we wouldn't really encourage you to delay for your to put your application in. So are they saying that putting the last results in? Is that what you're saying?
Yeah, waiting for semester 1 results.
Yeah, we would, because we wouldn't want you to miss out. So we would just go ahead. We would advise you just go ahead and put your application in. Obviously, in the past, sometimes we have had to, we've accepted, say, late appraisals or your replies and stuff. We have accepted them in the past, and these are very much in a case-by-case scenario type thing. So I wouldn't delay because you don't want to miss out. So we would judge that once your application comes in.
We mentioned, is there a possibility to start February 2021 for the applicants who are PMCV ineligible? Yeah, so when you lodge your application for the PMCV ineligible streams, you'll see that there are options to start in either February or August, and you do need to select which option you're interested in, and then it depends how many positions we're able to offer in each intake as to how many people that we offer.
This is about
mental health. All right. So for mental health, do we need to have a postgraduate diploma to apply, or would have been? Definitely not. You actually can't get a postgraduate diploma unless you are actually within a graduate program. So you definitely will have to apply without a postgrad diploma. It's more when the graduate program has finished, and if you want to obtain employment in mental health, you need to have evidence to show that you have your postgraduate diploma or you are working towards it.
This is about postgrad. So obviously as an organisation, we do obviously encourage our grads once they kind of finish their graduate and then move on to different areas to, if they want to go ahead and support and apply for postgrad studies, that's not a problem. Again, that's dealt at a local level, within the area that you're working. So it's obviously you would have to apply for them. Names, obviously, we're happy enough as educators support you during that application process and the ongoing support that you would be required. I'm not too sure about the nurse practitioner pathway. Are you able to answer that, Shell?
For me, yeah, we definitely do encourage people to look at nurse practitioner roles. We certainly have a nurse practitioner who's currently on maternity leave. So she is a nurse practitioner with physical health in mental health. We had one in drug and alcohol, and we're looking at having one in the emergency department within our new ED hub here at Clayton. So it's very much supported, yes, and our Director of Nursing supports and supervises and ensures that the nurse practitioners have support along the way. So yes, it's encouraged.
I noticed there's no mature age grads being represented. Is there equal opportunity for mature age applicants? Yes, by all means there is. I'm sorry that you felt that, because obviously that was just a small snapshot of our grads. We did put it out to quite a few grads, but then obviously working opportunities and like days off and stuff like that, they won't be able to come in and stuff like that. But I mean, I could name you quite a lot of older grads, mature age grads who are currently working here and who have worked with us in our grad program over the past few years. And the opportunities there, you just have to apply by all means. That's definitely, I can definitely say we have a significant number of mature age grads working with us at the moment. And after their graduate, they go on to do wonderful jobs, and they go on to be educators, do research, do lots of different things, whatever they want to do. The opportunities are there for them as well. Good question.
I finished mid 2021. Should I apply now for the mid? Yeah, so because we're a public organisation and we have such a big mid-year intake program, we have to get our mid-year applicants in the PMCV round the year before. So we will be taking applications for 2021 August programs in this round of PMCV. Yeah.
Next, do all referees have to be clinical referees, or can we have referees from part-time alternative referees? So as Stacey said, the PMCV, they request 2 references. So those 2 references obviously need to be clinical. We on our application template, we request the contact details and nominations for 4 references, and we do prefer them to be clinical as much as possible. That's why now and those guys, those first and second year who are attending this expo should now be starting that process to make those contacts, to have referees in the back of your pocket. So we really wouldn't, to tell you the truth, we do have a number of like say for instance Monash Health employees who are applying for the graduate here. We don't particularly take they may offer us a referee, say they've worked as a ward clerk on a particular ward, so they may want to put down the manager on that ward. So that's not an ideal reference, to tell you the truth, because they just know that person as a ward clerk, not as an undergrad student. So that's why we really do prefer to have a clinical one. So it could be 2 clinical people out of the same rotation. It could be an ANOM, a clinical support nurse, could be a preceptor, could be a nurse educator. So, you do have lots of scope to work within. So, but the main thing is really, especially for those guys, always, start doing those phone calls, making those contacts, and you should have had them done already, but definitely if you're second year, start getting your referees now in your back pocket that you can pull out, like a deck of cards is here, and make sure you keep in regular contact with your referees. Send them a picture, send your recent appraisal, blah, blah, blah. But we don't really want employees, would probably be the same.
Mm-hmm. Is your graduate year a permanent contract? Does your employment end after 12 months? So the graduate contracts are 12 months temporary contracts, so they do end after 12 months. In saying that, Anne-Marie's already touched on the fact that we recruit at least 94% of our graduates every year. Most of the time it's more than that. And our graduates, at the end of their contract, there's a special pathway that we have for our grads, whereby managers can approach them and run recruitment into the spare EFT that they have in their ward areas, or the open positions that they have in their ward areas, without having to go through an extensive recruitment process, because the grads have already been through that the year previous. Some of the TSPs do still run a recruitment process whereby they do interviews and that sort of thing. So it is dependent on the area and what exactly it is that the grad wants to do at the end of the year.
If our third year placements were scheduled, I'm moving, okay. Okay, if I apply for both acute and complex streams, does this result in 2 separate interviews? No, so if you could apply for acute complex August, and it would only result in 1 interview. And then obviously, you know, you have your mental health interview as well, but yeah, just the 1 interview. I like that one.
Sorry guys, I keep muting myself. Parking, yeah. So when you go to a public hospital like Monash Health and you get your parking, so you do pay for parking. It's an automatic thing. If you want to do it, it's obviously an opt-in thing. It's not mandatory. So if you don't use the parking, you don't pay for it. But every fortnight when you get paid, a small amount comes out for parking. Here at Monash Health, that allows you parking across all of the Monash Health locations.
RMIT's appraisal is about 40 pages long, is it? Wow, okay.
RMIT and Latrobe.
Is it? The marking is spread out through all the pages. Just wondering, is that acceptable? It's going to have to be. Really?
Yeah, so we do need, we do need complete appraisals. We are aware that Latrobe's is also quite long. The Deakin one is not too bad if you take out all the marking guides, and the Monash one I think is the best one because it's really short. But essentially, just give us what, just give us, you know, wherever your preceptors had to mark you or give comments, then yes, please give that one to us. The only thing you need to keep in mind is that when you go into the Monash Health eMercury system to upload your application, there's only one field for the appraisals, so you will need to combine them into one file. The best way to do it would probably be to PDF them and then go onto like a file compression site. There's lots of free ones on the internet, and then just compress the PDF. But I think the file sizes are quite generous in the fields, so usually we don't have issues with file size. It's more people trying to upload multiple files to one field that can only take one file. No, it's external. Yeah.
If our 3rd year placements were rescheduled to later in the year, are the 2nd year CAT tools sufficient? Yeah, we appreciate it. We acknowledge that, you know, all of us acknowledge that things are quite different this year, obviously for a number of reasons. So yes, we are happy enough to accept that. Yeah. And again, if in doubt, you know, if you're worried about anything, just contact the graduate office, all of us, and just drop us in an email, and we'll try and respond within 48 hours.
What is the ratio of applicants to those getting hired? Slash, we would call applicants unsuccessful if they weren't hired. One of the main reasons an applicant gets made unsuccessful. The first one is just not following our instructions, you know, giving us an incomplete application. If you give us an incomplete application that's missing clinical appraisals or that's not filled out correctly, you're pretty much just giving away your opportunity. You know, it's why we've spent so much time on the application template, why we spend so much time on the application guidelines, why our stuff has come out a little bit later this year, because when we put stuff up, we want to make sure that it's clear and it's concise and it's exactly what we need so that you guys have everything that you need to be successful in this process. So, you know, make sure you read those application guidelines because there's always people who just don't, and that, you know, incomplete applications is just a quick ticket to the unsuccessful box, really. So there's that. Obviously, you know, how well you do at interview does impact a little bit on how we recruit, and you know, I think that in interview, we do understand that you're nervous, and we do understand that it's a very anxiety-inducing process. So, you know, just remember that we do want to meet you. So we do want you to be honest, and we do want you to be yourself. So make sure that you're taking a deep breath and you're really thinking about the questions. And we know that a lot of you guys will do a lot of practice for interviews, and the trap that some applicants fall into is that they've prepared so much for the interview that they are going to give you those prepared answers regardless what questions you ask, because they've got their prepared answers and they will stay with those answers. So make sure you're listening to the questions properly, and you know, you sort of, if the question's a little bit different from what you've prepared for, you know, just take the bits that are relevant, because it is very tempting, because you're so nervous, just to sort of spit back that pre-prepared answer, but a lot of the time it kind of misses the mark. So make sure that you're listening to those interview questions really carefully and that you're structuring those answers. The other thing is listen for those key words. So for example, if an interview question has in it that, you know, give us an example of a time, give us an example. You know, when I was on placement when I was working at KFC, when I was, you know, the youth leader in this scout troop, this is what happened. This is what I did, and this is what I learned from it. You know, actually give us those examples. You know, when we ask for example questions, we want to hear that scenario. Similarly, if we're asking you for sort of, you know, 3 things, you know, give us 3. So really, it's all about that listening carefully and preparing carefully, and then giving us exactly what we've asked for, how we've asked for it.
So I'm just conscious of time, guys, so I think we'll just take 2 more questions, and then we do keep your questions on file, and obviously we pull together the themes, and then we will be finalising a FAQ sheet that we will make available on our website that's going to address these questions that you guys. So I do appreciate it. Thank you for your thing, but we'll just take 2 more questions, and we'll have to kind of start wrapping up. So do paper-based appraisals need to be certified? I thought we answered that one. They come through the university. So if they come through the university, they should be marked and stuff, but they don't need to be certified as such. Last question, I think.
Peri-op supernumerary time, selection criteria for the graduate year application. How much do we look at academic results, educator feedback, interview and referee comments? Yeah, so our selection criteria questions are on the graduate application template. You'll notice that there's a section with 3 questions on it, which I think we've given you 250 words to answer each question. Have a good think about those and do some planning. They are a little bit different from previous years. So this year our selection criteria questions are transitioning to about our eye care values, firstly. Secondly, about skills and attributes for graduates. And then our third one is looking more at sort of, you know, why you became a nurse and you're and dealing with high pressure situations and that sort of thing. So there are 3 questions on our application template for you to go and have a look at, and you'll need to fill that out and submit them. As I said previously, we look at academic results, educator feedback, interviews and referee comments, all as part of the bigger picture. So in that way we find that even if grad applicants might lose a few marks in one section, they have an opportunity to sort of make that up in other sections, because we do appreciate that everybody has different strengths and everybody has different weaknesses, and that's what makes Monash a great place to work, is that diversity. We complement each other and we bring each other up as a team. But you know, and that's why we don't necessarily just look at one thing, like maybe you didn't have a great interview, because let's face it, everybody has a bad day. And some of you will go to interview and you'll think to yourself, oh God, I bombed that. You know, I got tongue tied and the cat was in the way and it was just bad news bears all around. But, you know, that's okay, because you may have got a really good answer to your selection criteria questions, your academic transcript may look pretty solid, and you might get good feedback on your references. So that will kind of pick you up in other areas. So we do look at the overall picture. Okay, wrapping up. All right, guys, so we might wrap up there. The first thing that we would like to say is thank you so much for being here with us today. We do really appreciate it, and we wish you all the best for your applications and for your graduate year and your future careers beyond. It's such an exciting time to come and join our profession. So we are really thankful that you were taking the time to be with us here today. The second thing that we would like to do as a graduate team is express our thanks to all of the people who supported us today in getting this Graduate Virtual Expo up and running, including Tim and Alison and Tamar and Chris in our public affairs and communications team, who have been working very hard behind the scenes to get our website up and running, to get our virtual expos up and running, obviously assisting us with Slido, and all of the rest of those things. We really could not have done it without you guys, so thank you so much for your help. The other people that we'd like to acknowledge is our co-workers, specifically our administration team, Liza White, who is our administrators, Linda Piper, Maria, and all of those guys in the office who just help keep the graduate program running smoothly. And then, of course, all of our educators and managers out there in our operations who support our grads every day so that we can do the valuable work and provide the valuable care that they provide. So in closing, please go and check out the website. The application templates are up in the resources section at the moment. Our new booklet for 2021 programs has gone up. We will be sending you out some information post this event, which has some like a quick reference guide to it, and a recording of this session will be going up, and a special login for, link that will allow you to access that recording will be going out to participants. And as Emery said, our FAQs on the website will also be updated to reflect the Slido questions. Do you guys want to add anything else?
No. You've said it all.
All right, guys, we will let you go. Thank you so much for joining us here today. Oh my gosh, I almost forgot, Emery.
Oh, Stacey.
I almost forgot. We have prizes. I completely forgot about that. I haven't got my phone. So, Tim, can we please put up the sponsor slides? So we were very fortunate to be sponsored for this event by our sponsors, and they have actually kicked in for some prizes. So firstly, we would like to acknowledge Maxia, who does our salary packaging here at Monash Health. And then next slide, please, Tim. And Bank Vic as well, who provide banking services for nurses and midwives, and there is a Bank Vic branch on site here at Clayton, and we'd like to acknowledge those two sponsors. And then finally, we would like to acknowledge Hester, who have sponsored one of our prize draws today, and the winner for the Hester prize is Georgia Lucan. So congratulations to Georgia for the Hester giveaway. So those we'll be contacting you to organise to send that out to you. And then our final giveaway was sponsored by First State Super, and they are actually giving out a Fitbit to one of our attendees. So so our winner is down there.
Lydia Burns, B-Y-R-N-E-S. Congratulations.
Yay! So congratulations, guys. We'll be contacting you via email to organise to get that stuff sent out to you. So thank you so much to all of our sponsors as well.
Yep.
So now that the fun part is done, we will wrap up, and thank you so much for being here, everybody, and we hope to see you around at Monash in 2021. Thanks, guys.
Bye.